Good afternoon, my good people. Welcome back to our discussion of the day. We are still discussing about kidney failure, which is a very important topic and which is one of the topics that most people had requested. And today we will be discussing about how to lower the risk of kidney failure, or how you can prevent, in other words, your kidneys from failing. And before we continue, if you are there and you are watching this channel for the first time, I always beg you to take a second or two, click the subscription button, put the notification bell on, so that whenever I upload a video like this, YouTube will automatically notify you and you will never miss any of our topics. For the returning subscribers, feel appreciated. And if you have given out your topic and it has not been discussed yet, just be patient with me. And in due time, it will be discussed and you will get what you have been looking for. How to lower the risk of kidney failure. How to lower the risk of kidney failure. How to prevent your kidneys from failing. Number one, eating a balanced diet. Eating a balanced diet. A balanced diet means that it contains all the necessary nutrients for your body. Number two, maintaining moderate weight. Maintaining moderate weight. Number three, taking prescribed and over-the-counter medications as directed and not taking more medications than is safe. Don't overdose. Taking prescribed and over-the-counter medications as directed by your doctor or your pharmacist or your healthcare provider, and not taking more medication than is safe. Through this, your kidneys will not be overloaded by the toxicity of chemicals in your body, and you will always keep them safe. Don't overdose any medication. Take it as prescribed, and your kidneys will be safe. Number three, keeping conditions such as diabetes and hypertension well managed following doctor's advice. Remember, we said that diabetes and hypertension are the major causes of kidney disease or kidney failure. So if you find yourself having these conditions, make sure that, and this is very important, make sure that they are well managed and within the normal limits. And if they are within the normal limits, your kidneys will always be safe. Make sure your blood pressure is within the normal limit. Make sure your sugars or your sugar levels are within the normal limits. And that way, or by so doing, you will be helping your kidneys, or you will be reducing the risk of kidney failure. A point to note, and this is very important, kidney failure can develop suddenly or from long-term damage. The sudden one is what we call acute kidney failure. And the one that comes over a period of time is what we call chronic kidney failure. Kidney failure can develop suddenly or from long-term damage. Possible causes of kidney failure can include diseases like hypertension and kidney trauma. Let me repeat this again. Kidney failure can develop suddenly or from long-term damage. And possible causes of kidney failure can include diseases like hypertension and kidney trauma. Kidney disease is classified into 5 stages ranging from mild to moderate kidney failure. Kidney disease is classified into 5 stages ranging from mild to moderate kidney failure. Symptoms and complications include symptoms and complications increase as the stage progresses. So when you progress from stage 1 of kidney failure to stage 2, the complications also increase, and the more difficult it is to manage. When we go from stage 2 to stage 3, the complications increase. So when a person is within the first stage of kidney failure and another one is at the 50th stage of kidney failure, complications will be indifferent. The one who is at 50th stage will have more complications, will have more difficulties in managing this type of a condition than the one who is within the first stage of kidney disease, of kidney failure. So symptoms and complications increase as the stages progress. If you have kidney failure, you can work with a doctor to determine the best treatment options. If you have kidney failure, you can work with a doctor to determine the best treatment options. Let's look at the signs of kidney disease. Or how will you tell that this person is having a kidney disease? Kidney disease rarely presents early stages. Remember we said the early stage of kidney failure is asymptomatic or may not show any sign. So, kidney disease rarely presents early stages. It must be at advanced stages before any of the symptoms appear. So for the symptoms to be seen, it must be at an advanced stage. This tells us that when kidney disease it is at its first stage, you might not notice because it's always asymptomatic or presents with no signs. But when it is in the advanced stages, the more complications appear, more signs will be seen. That's why we are saying kidney disease rarely present early stages. It must be at an advanced stage before any of the symptoms appear. The earliest sign of kidney disease is an atypical level of creatinine or urea in blood. The earliest sign of kidney disease is an atypical level of creatinine or urea in blood. Remember, creatinine and urea are very dangerous and toxic to your body. They are always eliminated by the kidneys. So when the kidneys are failing, it means that their functions have been compromised or they are not working the way they should be working. So creatinine and urea will remain in the systems or in the blood because they are not being eliminated and they are very toxic. That's why we are saying the earliest sign of kidney disease is an atypical level or increased level of creatinine or urea in blood. This leads to a condition called uremia. The increase in urea in your blood leads to a condition called uremia. A basic metabolic pattern or BMP. A basic metabolic A basic metabolic pattern or BMP is a blood test ordered to as part of routine physical examination. A basic metabolic pattern or BMP is a blood test ordered to as part of routine physical examination. This test allows healthcare provider to direct any atypical levels of these two chemicals. This test allows healthcare provider to detect any atypical or increased levels of these two chemicals or of urea and creatinine, in other words, uremia. This marks the end of our video today. Thank you for those who are following me. Thank you for watching. Let's continue liking, subscribing and sharing these videos so that they may reach as many people as possible. And our channel will grow bigger and bigger and we will continue getting these educational bangers each and every day. Let's have a lovely day ahead.